Let's look at the infrahyoid muscles, which all in a way function to lower the hyoid bone. And we're also going to tell you about two other muscles at this point, the sternocleidomastoid and the scalenus anterior muscle. So the sternocleidomastoid muscle originates from the lateral surface of the mastoid process and inserts into the anterior surface of the manubrium and the adjacent upper surface, which is the medial third of the clavicle. So to clarify, the anterior surface of the manubrium and the upper surface of the medial third of the clavicle. And this is what the sternocleidomastoid looks like right here. Its function is to help you rotate the neck or turn your head, okay? Its innervation is from spinal accessory, which if you reflect over, you might see on its medial surface, okay? It's innervated by spinal accessory, cranial nerve number 11. Before we get to the infrahyoid muscles, I also want to point out to you the scalenus anterior muscle. And the scalenus anterior muscle is going to be running deep. It's going to have the phrenic nerve actually running on its anterior surface. And it has the subclavian vein passing anterior to it and the subclavian artery passing posterior to it. It originates at the transverse processes of C3 through C6, and it inserts into the scalene tubercle on the first rib. The nerve innervation is part of the cervical plexus. It branches from C3 and C4. Okay? So that would be the scalenus anterior muscle. Now when we look at the different muscles of the infrahyoid muscles, of which there's 4, also known as the strap muscles. The first one we're going to look at is the omohyoid. The omohyoid is the most, first let's separate them into two different categories. First you have the two superficial muscles, strap muscles, and then you have two deep strap muscles. Okay? Of the two superficial strap muscles, you have one that's more medial and one that's more lateral. The most lateral and superficial of the strap muscles is the omohyoid muscle. The omohyoid muscle, what you're seeing here is actually the superior belly of the omohyoid muscle. It attaches to the lower border of the hyoid bone and inserts into its intermediate tendon. The intermediate tendon is actually held to the clavicle by some connective tissue, and then the inferior belly goes behind and inserts into the scapula. The other superficial strap muscle, and more medial of the two superficial ones, is the sternohyoid. The sternohyoid muscle will go from the posterior surface of the manubrium and the adjacent posterior surface of the clavicle, so down here, and insert into the lower border of the hyoid bone. Okay, this is the hyoid bone right here. Get that gland out of the way so you can see. Okay? So when we take omohyoid and sternohyoid and we reflect them back, we're still keeping in mind that this is the hyoid bone underneath here that I'm pushing on with the tweezers. Okay? Then we have these two deep muscles, deep strap muscles, which look like they're almost continuous with one another. The first one is the sternothyroid. It goes from the posterior surface of the manubrium and the adjacent posterior surface of the first rib and inserts into the oblique line of the thyroid cartilage. So these fibers here make up the sternothyroid. Okay? And then the thyrohyoid goes from the oblique line of the lamina of the thyroid cartilage and goes into the lower border of the hyoid bone. That's these fibers here. So again, a quick review. We have the omohyoid muscle, originates from the inferior border of the hyoid, inserts into its intermediate tendon, and then this is the superior belly of omohyoid. The inferior belly goes around and into the scapula. The most medial of the two superficial muscles is the sternohyoid, which originates from the posterior surface of the manubrium and the adjacent posterior surface of the clavicle, and it goes into the lower border of the hyoid bone. Reflecting those two up, we have our sternothyroid muscle. The sternothyroid going from the posterior surface of the manubrium and the adjacent posterior surface of the first rib and up into the oblique line of the lamina of the thyroid cartilage. These are the fibers here. And then we have the thyrohyoid, which are these fibers here, going from the oblique line of the lamina of the thyroid cartilage and into the lower border of the hyoid bone. All of the infrahyoid muscles are innervated by part of the cervical plexus, cervical spinal nerves 1 through 3. And they all function, as I stated before, to lower the hyoid bone.